Greg? Can you hear me, Greg?
Yeah.
Oh, it's all right. It still had to start so I just need to start it and stop it again. Sorry, it's fine.
Okay.
Don't worry.
All right, no problem. I will.
Good morning, everybody. I'm Paul Johnson, Director of the IFS, and I'd just like to welcome you to this edition of our latest edition of our webinar series. This one will look in particular at the inequality effects of the current pandemic. It's part of the IFS Deepen Review of Inequalities, funded by the Nuffield Foundation, which is looking in very broad terms at what has created inequalities over recent decades and at policies for the future. But as you'll see, we've been interrupted by as has many things by the pandemic. And this particular piece of work will look not just at the immediate effects of the pandemic on inequality, which, as you'll see, look very substantial and very profound, but also look at the possible longer-term consequences, both for inequality and for policy responses to it. We think that these will be substantial, and that the conclusions of the whole review, which is due to run still for a couple of years, will be significantly affected by what is happening at the moment and by the likely policy responses. Today, two of my colleagues will be speaking. First up will be Xiaowei Zhu, who will be talking about the immediate inequality effects of the pandemic. And then Richard Blundell will put some of that into longer term context and talk about some of the possible implications for the future. They'll speak for 20-25 minutes between them. That will leave us with plenty of time for questions. If you have questions, if you want to email them to events@ifs.org.uk, that's email them to events@ifs.org.uk, then I will take them and throw them to Richard and Xiaowei. But with no further ado from me, I will hand over to Xiaowei to talk about the immediate inequality effects of the pandemic.
Thanks, Paul. So much of the debate about the impacts of the pandemic, our responses to it, and also the longer term legacy it may leave are really about various forms of inequality. The pandemic has really highlighted the inequalities in our existing system. So for example, some households are just in a much better position to weather the economic shocks than others. And of course, those in nicer housing would find it much easier to social distance and self-isolate. I think the pandemic has also drawn attention to the state of our benefit system, which after 10 years of cuts is really quite poorly equipped to provide social insurance against the sort of shock that we're seeing now. And that's why we've had policies like the furlough scheme and the self-employment support scheme essentially just drafted from scratch. But as well as highlighting existing inequalities, the pandemic and our policy responses to it have exacerbated certain inequalities. So for example, sector shutdowns, widespread working from home, school closures, and also the health impact of the pandemic have hit certain groups harder than others, in many ways exacerbating existing inequalities by income, age, gender, and ethnicity. And finally, changes in preferences and attitudes and technologies during the pandemic may well have a longer term legacy on inequality. So in this presentation, I'm going to focus on the second set of points, looking at how COVID-19 and our policy responses to it have exacerbated and interacted with existing inequalities. And Richard, in the next presentation, will talk through some of the potential longer-term legacies. The pandemic has in many ways hit low-income people the hardest. So this chart shows the share of workers working in sectors that were not shut down during the lockdown, so people working outside hospitality, retail, and arts and leisure by their level of individual earnings. So we see here that the highest earners were much more likely to work in a sector that remained operational during the lockdown than those at the bottom of the earnings distribution. Now, certainly in the earlier phases of the lockdown, it wasn't just sectors that were explicitly told by the government to shut down that were affected, but more generally, jobs that couldn't be done from home, so for example in construction, were also disrupted. And if you combine this picture with information on who can work from home based on the occupations they're in, you see an even steeper gradient. So we see here that more than 70% of those in the top 10s of the earnings distribution worked in a sector that carried on operating and who could carry on working from home, whereas less than 20% of those in the bottom 10th of the earnings distribution could do so. Now, of course, what that means is that low-income people are much more likely than high-income people to have seen their hours reduced, have been furloughed, or have to have been laid off during the lockdown. And indeed, that's what we're starting to see in the official furlough data. Sector shutdowns have hit richer households in quite a different way. So if you look at the spending patterns of different households, we see that for those in the richest fifth of the income distribution, around a third of their household spending prior to the pandemic went on services and activities that were forbidden during the lockdown. So things like public transport or hotels and restaurants. Now, of course, it's exactly this spending that provided the livelihoods of those on lower incomes. And if you look at their spending patterns prior to the pandemic, you see that for those in the poorest fifth of households, the majority of their spending went on necessities like groceries and housing and utilities. So we saw in the previous slide that they're most likely to take an income hit. What we see here is that they'd also find it very difficult to adjust their spending in response to that sudden income shock. The health impacts of the pandemic have also fallen disproportionately on more deprived groups. So this chart shows the age-adjusted deaths from COVID-19 across different areas ranked by their level of deprivation. And what we see here is that death rates from COVID-19 in the most deprived areas were more than twice as high as in the least deprived areas. Now, it's generally the case that death rates are higher in more deprived areas than less deprived areas. But what I want you to see here is that the gradient for COVID-19 is even steeper. So the difference between the most deprived and the least deprived areas is even greater among coronavirus deaths than deaths overall. Now, there's a number of factors that are likely to come into play here. So, for example, we know that low-income people are more likely to have comorbidities that make them particularly vulnerable to coronavirus. They're also more likely to work in occupations that expose them more to the virus. So things like social care or working in grocery stores or working as bus drivers. And of course, they also live in more cramped housing and are less likely to have gardens, which then means that they're dependent on public spaces for exercise. Death rates from coronavirus are also concentrated among certain ethnic groups. And I think the difference here is really striking. So this chart shows for men and women how likely different ethnic groups are to die of coronavirus compared to the white population. So a value of 1 would indicate that they're equally likely to die of coronavirus as white people. And what this chart shows is that adjusting for the age profile of these different ethnicities, Black men and women are more than 4 times more likely to die of coronavirus than white people. Now, this is analysis by the ONS, and they show that a lot of this difference is explained by differences in where people live, in their socioeconomic conditions, so their education, broad occupation group, and so on, and also their self-reported health. But even controlling for these basic demographics, Black men and women are still around twice as likely to die of coronavirus as white people. And it's likely that some of the factors I just mentioned that are specific to coronavirus have a role to play here. So, for example, IFS research has shown that Black workers are disproportionately likely to be key workers, and particularly to work in social care, where we know that death rates have been very high. The pandemic is also likely to exacerbate intergenerational inequalities. So we know that the health impacts on young people have been smaller than for older people, but the economic impacts are likely to be much greater. This chart shows that before the pandemic hit, young people, and especially young women, were much more likely to work in sectors that have now been shut down during the lockdown. So that, of course, means that young people are much more likely to have seen their hours reduced, to be furloughed or laid off. That's, I think, also what we're starting to see in recent surveys that have been conducted during the lockdown. But it's not just young people who are currently in the labour market who are going to be affected. We've seen a collapse in vacancies all across the board since the lockdown began. And that means that young people just entering the labour market now will have a very hard time indeed. And this is worrying because we know from previous evidence that disruptions early on in people's careers have a long-lasting effect on their earnings and employment prospects later on. A recent survey has also shown that the mental health impact of the pandemic seemed to have been largest among young people and young women in particular. So we've seen the largest deterioration in mental health among young men and women. And these were groups that, even before the lockdown began, had the worst levels of mental health. So in this way, the pandemic and the lockdown seem to have exacerbated mental health inequalities as well. The pandemic also seems to be having an effect on gender inequalities. So an IFS survey has shown that mothers have been much more likely to have their careers disrupted than fathers during the lockdown. And that's especially the case for low educated mothers. So if you look at mothers without a degree, more than half of them have been either furloughed or laid off during the lockdown. It's interesting to note that the differences between mothers and fathers we're seeing in this survey are larger than differences between men and women overall that have been picked up in some other surveys. And I think this suggests that this has something to do with the additional childcare responsibilities resulting from school closures in the lockdown. The survey has also shown that mothers bear the brunt of the additional childcare during the lockdown. So we've just seen that mothers are more likely to stop working than fathers. And we see here that non-working parents spend more time providing childcare than working parents. But even within working parents, we see that mothers spend many more hours a day than fathers in providing childcare. So it does seem like, in many ways, the pandemic has reinforced traditional gender roles and increased gender inequalities. Though I think that there are potentially some silver linings on the horizon that Richard will talk about later. The last point I wanted to make was that school closures are also likely to exacerbate educational inequalities. So in this chart, you see that among state school pupils, those from richer families are much more likely to have received direct tuition than those from poorer families. So they're more likely to have had online classes, they're more likely to have been able to talk to the teachers directly through video chat or chat. Now, if you add private schools to the mix, that difference is even greater. So nearly 80% of pupils in private schools have received online classes, compared to just about 40% of pupils in the poorest third of households who go to state schools. It's also likely, of course, that richer parents would be better able to or feel more confident in helping children with their schoolwork during the lockdown. And this is really worrying, I think, because it shows that the pandemic has the potential to undo many years of slow progress towards closing educational attainment gaps, which then have very negative implications on social mobility in the future, and also on inequalities within the next generation. So I've talked about some of the ways in which COVID-19 and our responses to it have interacted with inequalities in the short term. I'll now hand over to Richard, who will talk more about the potential longer term legacy.
Thank you, Xiaowei. Thank you, Paul. Thank you. I'm going to take a look forward here and think about some of the risks and opportunities and policy challenges that have been brought about after COVID, looking forward after COVID. We've seen from the work Xiaowei has presented how the pandemic has exacerbated existing inequalities in wages, employment, health, gender, ethnicity, education, and across generations, and has opened up new fissures along dimensions that were previously less significant: working at home, homeschooling, use of public transport. And this following a decade of stagnation in median earnings, high levels of inequality in labor incomes, cuts in benefits, and poorer households facing low savings and higher debt. There are many, many policy changes ahead, but there are opportunities too, not only to address some of the most adverse impacts of the pandemic, but also to tackle some of the most pressing underlying longer-term inequalities. Will there be a new emphasis on building a fairer society? And that despite the challenge of doing so while facing unprecedented levels of peacetime debt. To answer these questions requires an understanding of the array of different inequalities in society and how they interact with each other. Exactly the IFS Deaton review. For some time now, incomes at the bottom have been increasingly supported by in-work benefits. This graph shows, this chart shows exactly this. If you look at the green line, this tells you the growth in average household incomes going back some time now. The green line shows a relatively low rise at the bottom of the income distribution. But if we add back in-work benefits, you can see that that's quite different. There's been a reasonable increase at the bottom. And this increased reliance on in-work benefits reflects growing employment, but almost no growth in earnings at the bottom. Recent benefit cuts have also fallen exactly on this group. If we look at this chart, we see the changes in net household incomes due to tax and benefit reforms in the last decade by household income decile. The red line is are the changes for working age families with children. And you can see it's that group at the bottom of those, of the income distribution for that group, that's taken quite large cuts. Of course, part of this has been offset by growing employment and increased work, especially among women. But let's remember, it's depressing at the bottom of the labor market. If you look at the wage profiles by age for different education groups, just the average here, you can see on this chart the three groups: those who left school at 16, those with A-levels, the red line, and those who complete university, the green line, have quite different profiles. At the bottom, apart from a small uptake at the beginning, it's a very flat, low profile of wages over your working career, whereas higher education groups see a steeper profile and a higher, long-lasting level of wages. This, by the way, is for UK women. If I added in UK men, you would see the profiles rising even stronger, highlighting the gender gap, especially, in fact, for the higher educated, that's been so stubborn and difficult to impact on. Put all this together with the large geographic disparities in education and skills, and you can see how there are areas with relatively low educated working age families where we know from what I've shown you already, wage profiles across the working career are very flat and low, where there's been increased reliance on in-work benefits. Look at the differences across geographical areas that are highlighted here. So where are the risks going forward? Think about wage and employment inequality. We've seen that low earners are mostly in shutdown sectors, being furloughed and at risk of unemployment. The self-employed and those with insecure work arrangements more likely to report negative impacts. The risk is that the increased reliance on technology and working from home will favor, as it will, the more highly educated at the expense of others, therefore increasing wage and employment inequality. Generational inequalities. We've seen how younger workers are more likely to have lost their job and experience a reduction in earnings during the lockdown. Those who would have entered work this year faced long-term scarring from the collapsing labor market. So after a tough decade, this could knock the younger generation back once more. Gender inequalities. We've seen how childcare and housework has fallen far more on mothers than fathers. This could further inhibit the wage progression I highlighted before for mothers, when progress in closing the gender gap has already stalled. Educational and family inequalities. We've seen that children in poorer families have lost most from school closures, while higher income parents are more able to work from home, have space to educate their children, and have savings for any unforeseen expenditures. This could put back years of slow progress on social mobility. Added to that are the additional risks from enhanced health inequalities and the severe impacts on ethnic minorities that Xiaowei highlighted. Of course, some inequalities may be reduced as house prices take a hit, high earners get less support during furloughing, but most of the changes are pointing the other way. Let me take 3 pre-COVID challenges. Leveling up prosperity across the UK, generational inequalities, and gender inequality. The pandemic may have moved us backwards. In terms of leveling up, the most deprived areas are also those where the most vulnerable live and where new jobs will be slowest to appear. They are the places where already fragile high streets are further threatened by online commerce. In terms of generational inequalities, younger generations face the largest scarring effects on job prospects, paying a larger amount of the cost of lockdown via higher taxes, both in the short and longer terms. In terms of gender inequalities, women are more likely to work in shutdown sectors and, crucially, have been taking a disproportionate share of the huge childcare responsibilities parents are shouldering, with likely longer term impacts on earnings. Women seem to have suffered most from mental health deterioration too. But there are opportunities. Let's think of those in 2 broad ways. The first being changes in attitudes. With such a big changes in society that could lead to a tipping point for changes in social norms. There's also a desire, I think, for large-scale policies to address long-standing inequalities. More people will have experienced the welfare state, which could change attitudes. The UK safety net has been challenged by the fall of earnings and employment across the distribution. Perhaps there'll be a new emphasis on social insurance, which has all but disappeared in the UK. I'll return to that. The large numbers of younger low earners coming out of lockdown could force a rethink of further education and vocational training, focusing on the skills to complement new technologies. The experiences of people working from home could provide the tipping point for a change in the way we work, which might spread prosperity more evenly across the country. Women are more likely to be key workers, and any pressure to increase the pay of key workers could help reduce gender inequalities, as well as income inequality overall. The experiences of childcare among many more men could provide a change in social norms to generate an even balance in childcare that has been so hard to achieve to date. And perhaps the health, economic and disadvantage, the way they've come together and shine a light on pockets of local deprivation could give additional urgency for effective place-based policies that build resilient communities. So, what are some of the policy responses and challenges? Let's think of the safety net. Will the increased generosity in sick pay, in housing benefit realignment, and universal credit be reversed? Should they? Universal credit, I think, will need a further redesign to enhance earnings progression rather than just simply income support and employment. And there'll be a new urgency to think of whether we should move the welfare system towards more social insurance with a higher replacement rate for moderate earners. Indeed, the Covid-19 crisis has highlighted a limitation in our safety net in the UK. That is the weak link between the benefit entitlements and the actual costs families face. For moderate earners, the level of replacement income is low, especially in comparison to other European countries. The uplift in housing benefit and in universal credit during the pandemic And of course, the furloughing system, which has supported up to 80% of earnings, especially among low earner, moderate earner workers, has forced us to rethink the way we envisage replacement income during economic shocks. The idea of social insurance is to do exactly that, to provide more insurance for moderate earners, not just replacement income at the bottom. But there are downsides in social insurance too. Of course, it's a welfare system that requires contributions, and we know that requires a well-defined population and doesn't work particularly well in dynamic economies with changing demographics of the type we have in the UK. So I think what we need is a really serious rethink of how and whether we should introduce social insurance. Let's think about education and training. Children, especially poorer children who are missing out in school, will clearly need additional teaching post-crisis. We're bound to now rethink vocational, further educational, and active labour market programs to focus on skills that complement wage progression and new technologies, green technologies. We should look again, I think, at tax subsidies and tax credits for training, perhaps integrating the requirement for training together with the benefits that come through universal credit. And remember the key role that training can play in replacing lost work experience of parents, which has been even more highlighted during this pandemic. Thinking about wage inequality, will there really be pressure to enhance the wages of low-paid workers? Or will the increase in demand for e-commerce and IT dominate with an increase in the education premium and for those that can work at home, thereby increasing wage and earnings inequality? When it comes to leveling up, there are dangers to be navigated here. We want leveling up and not leveling down. And we need to make sure we don't lose out on the agglomeration benefits of large and successful cities with research universities. Market power too is something that can affect inequalities. And let's think about it. Large, already successful firms do find themselves in a position to capture a larger market share coming out of lockdown and have greater influence on prices and wage setting. Just think of the recent part takeover by Amazon of Deliveroo. We need to rethink competition policy for firms and for workers. In each case, it's clear that preemptive and forward-looking policy will be crucial. Of course, this is just some of the responses and some of the challenges, but you can see the extent and the need for integration here across all these aspects of inequality. You can find more of this in the briefing note that we also published today. So I'll hand back to Paul. Thank you.
Well, thanks very much, Richard. Thanks very much, Jiawei. And thank you all who are listening. We've got a number of questions come in already, but just to remind you, if you've got more questions, please do send them to events@ifs.org.uk. That's events@ifs.org.uk. I'm afraid, Richard and Jiawei, the questions that come in are rather tough, so we'll see see how we go with them. One of them is about health inequalities. It says that there are a number of new inequalities revealed. How can one correct for these health-related inequalities for different groups in society, given that we already have a free health service, free at the point of use? Do we have any sense of the sets of policies that can help with health inequalities, given that we start with a health service which is designed really specifically to achieve that?
Do you want me to? I think, okay, a couple of thoughts there. One is just to note the integration. It's health inequalities are related to lots of other inequalities in society. And a key reason we set up the Deaton Review, but we're not the only ones who've thought about the integration of health inequalities with other inequalities in society. My colleague Michael Marmot has stressed this for a long time. And in a way, it's the coming together of a number of policies here. As I mentioned, these pockets of local deprivation have been particularly highlighted during the pandemic, and that's one way we could think about policy, an integrated policy here. And I think that's a useful thing to be thinking of long term. It's also worth thinking, and maybe Xiaowei will have more to say about that, about the differences in health inequalities across the different ethnic divides. This has been highlighted here, and maybe we need to rethink, even within the NHS, how we're dealing with different ethnic minorities in both access and the type of service being provided.
Yeah, so I would just reiterate Richard's point around health inequalities being very interlinked with other forms of inequality. So we know that there's a very strong correlation between poor health and long-term health conditions and being on low income. So I think you can't think of health inequalities in a vacuum without thinking about the socioeconomic conditions people live in and thinking about how to address those, which Richard has talked to. I think the second thing is that it seems like one aspect of health inequalities that are emerging during the lockdown is this massive inequality in mental health, and the way that the pandemic seems to have exacerbated that inequality. So we know from data prior to the pandemic that women had poorer mental health than men. Young women in particular had very low levels of mental health, and that's also the group that's seen the largest deterioration in mental health during the pandemic. So I think, especially given the way the pandemic is dragging on and there's still no medical solutions in sight, I think perhaps that calls for a refocusing of healthcare resources towards mental health.
Great, thank you. It's certainly the case that we know that in the end, healthcare systems themselves are only one surprisingly small part of the health and welfare of populations, and how socially just and equal the society is, how much value it puts on things like mental health, how it looks after the jobs and incomes of younger people, are all incredibly important parts of a healthy population, and one where that health is reasonably equally distributed. There seems to be remarkably little correlation between those things and the structure actually of healthcare systems, as the question suggests. There's another rather big picture question here, which I suppose is very much related to the whole reason for having this webinar, which is really thinking about the long term. If we compare, is there anything we can learn from big disruptive events in the past, like the last, Second World War, to understand how policy might address these unexpected equality impacts? So if you look back to the 1940s, really, that's when the welfare state and the health service were put in place. And I suppose that another way of asking that would be, is this an event that is that big, where we might really expect these sorts of changes, as some of the things you were saying, Richard, sort of suggested? Or are we sort of overreacting to something which in 5 years' time we'll have, forgotten about, or at least will remember in no more as nothing much more than just another recession or just another event, and then we'll get back on with our lives? So, Richard, do you have any thoughts about those sort of long-term questions as to whether how we might expect, or what we might learn from history about how policy might respond over the next few years?
I mean, there's the old point that big changes in policy, especially in regard to inequality, often only occur during revolutions and war, or after revolutions and war. And in fact, I don't think we're underestimating the impact of what we're seeing now, and I think it's largely a very depressing thing we're going through. But I think we can see the opportunity of a largest change in attitudes, and in a way viewing, as I mentioned, social insurance redistribution, the kind of idea that perhaps we need to provide a little more across the distribution rather than just looking after those right at the bottom. So society may be about, in a sense, to have a bigger role in people's lives, and it's possible that there's a more willingness to consider these large-scale policies. After all, they come together with a big change in attitudes. So with a big change in attitudes, you have the possibility of doing some large-scale reforms. And I think the reforms are the reforms that we could do are fairly well worked out. And perhaps you can, as you said, learn a little bit from going back even to the days of post-war when the welfare state was first introduced. And I think the coming together of a big shared event like that, we can have a similar sharing of experiences here. As I mentioned, a bigger sharing of people experiencing the welfare state has made it more open for people to rethink the way that's working. So I think there is some reason to be optimistic that we could be in a period for quite serious policy, large-scale change, which would hopefully improve the underlying adverse inequalities that have grown in society over many decades now.
Yeah, I mean, I think this is really not like any previous recession, and I think, you know, we'd be much better off comparing it to something like the war than recessions we've seen in the past. I think there's sort of two ways to think about this. One is just the magnitude of the shock that we're experiencing. So we know that, you know, that the spike in benefit claims, for example, or the collapse in vacancies is just really unlike anything we've seen in previous recessions. So this is really a much larger shock to the economy than, say, the 2008 recession, which, by the way, we still talk about all the time. I think the second thing is that this is really an external shock to the system, right? This isn't a recession that's emerged because of underlying structural problems in the economy, and it's, you know, absolutely nobody's fault, and no one can point any fingers. It's just something that's happened to us as an entire society, an entire world, and I think that might create different attitudinal shifts than previous recessions would have done. And I think, you know, I have said that in many ways the consequences of this pandemic have been depressingly usual. So we've seen low-income people hit harder than high-income people, in many ways women being hit harder than men, etc. But I think, you know, it is the case that people across the income distribution have been affected, and as Richard said, many people who would have never expected to fall back on the welfare state have ended up relying on the state for insurance. So I think that does have the potential for a much larger shift in attitudes than we've seen in previous recessions.
I think you're both probably right that underlying any change in policy is likely to be a change in attitudes, which we may have seen as a result of, as you say, some people who would never expect to have been on welfare ending up on welfare benefits, as we have appreciated, perhaps as much as we should in the past, those in key worker positions who may not have higher education at the top universities, but are actually kind of more useful than some of us who do. And hopefully a response in the further and vocational education sector, as well as across the public sector more generally. And I think that's part of what happened after big wars in the past, as societal attitudes changed. Next question is sort of related to that, actually. It refers to the cost of the response to the pandemic, and asks what we can learn from the response to the financial crisis to ensure that austerity policies don't again hit the poorest hardest and exacerbate inequality further. And I think that speaks to one of the charts you showed, Richard, which showed that the cuts to welfare benefits since 2010 had have hit those towards the bottom of the distribution relatively hard. I mean, I think I'll start by providing a bit of an answer to that, which is that it relates I think it relates very directly to some of what we've been saying about how attitudes have changed. My view is that it's pretty implausible that we will, even in the medium run, respond to this increased debt and deficit by cutting back spending further. We've had a decade in which most areas of government spending have been cut pretty substantially. And the scope for doing more of that is limited, to say the least, with the possible exception of some of the specific benefits that go to those over the age of 65. But the scope there is still fairly limited. That leaves us in the medium run with a couple of choices. One, of course, is to live with higher levels of deficit and debt. I'm quite sure we will live with higher levels of debt for a period. And I suspect for the next 2 or 3 years at least, we will see that continue to rise. But into the longer run, we're going to have to stabilize that at least. That seems to be most likely to happen through some increases in taxes. How you not least because even given current policy, we're likely to have pressure for more spending on health, social care, education, as Richard was saying, benefits as well. So the real issue, I think, for probably not this year, not next year, perhaps not the year after, but soon after that, the real question is going to be, how are we going to raise taxes? Remember, we're not particularly highly taxed by international standards, although we are highly taxed by our own historic standards. That's going to be a very different kind of debate to the kind of debate we've had for a long time, because the idea of raising the tax burden has not been one that's been popular, certainly among governments.
Let me just follow up on that very last point. The last review we did at IFS of this scale was the Merley's review. And I think some of the points raised there are going to become particularly salient, in fact, following on what you said. There's lots of parts of our tax system that really doesn't tax very well. And that includes the taxation of capital, taxation of housing, and a number of aspects of taxation, which are in fact very important for both raising revenue and bringing a sense of fairness back to the tax system. So I think a relook at that could mean that we could indeed raise a little more money in a fairer way, with shared experiences across all our neighboring countries. In some sense, it's rather easier to do that because we're not one country alone doing something and the resulting effect of people moving around, taxes moving jurisdictions and what have you. In some ways, with such a common event, there'll be similar demands on policies across countries. And perhaps surprisingly, it's rather easier to do things, I think, when that's happening. The other thing I think we've learned from the last 10 years is the impact on younger people, on poorer people, on younger families has been really quite shocking. And the implications for social mobility and the future are really rather depressing. And I think it's very likely, therefore, that we'll see a move against that in the way I described. In fact, I think, if anything, we could end up borrowing more to fix some of these issues, which are worthy investments, at least in society going forward. And I think this change of attitudes will allow that to happen. But of course, we shouldn't forget the level of debt is extraordinary, and there will be pressures. We have to do these reforms in a careful and efficient way. And I think it's beholden on all of us, especially at IFS, to think these things through extremely carefully and not to jump into rather poor policy which will then end up going wrong.
Yeah, I mean, I don't have a huge amount to add to that, but I do think this does present an opportunity in some ways. Like as Paul said, I just don't think austerity is feasible given the last 10 years of cuts. I don't think there are any efficiency savings to be had in our public services anymore, and lots of public services are already showing signs of strain. So it does look like we'll have to raise taxes. And given we'll have to raise taxes, I think this is a really good opportunity to look at the tax system and look at how we can make it fairer. So I think there's already been some indication of, move for change, right? So the Chancellor, for example, indicated that the quid pro quo of increased support for the self-employed was higher taxes on the self-employed going forward. And that seems entirely fair because at the moment, self-employed people are taxed at a much lower rate than employees. So this is really an opportunity to start looking at other parts of our tax system, for example, the taxation of housing and of wealth, as Richard said, and look to build a fairer tax system going forward.
Well, there's a couple more questions that have come in, which are actually very relevant to the discussion we've just had. One is about the impacts of quantitative easing on inequality. One of the complaints, as it were, about the Bank of England's response to the last crisis was that very low interest rates and quantitative easing drove up asset prices, and that increasing asset prices benefited those already owned assets, whether that be homes or stocks and shares, but made them more difficult to, and particularly in the case of housing, more difficult to access for those who came out of the crisis or came into the crisis without those assets. Is there a risk that the large amount of quantitative easing we've seen this time round will do the same again and increase those inequalities in wealth, and particularly access to wealth between the generations?
Quick response. I guess that's right. And, if those increases did occur, then we need to be in a position to kind of correct them if they really are occurring among higher income people through the tax system. And again, we know that both capital gains, housing, variety of types of forms of income, if you want, are taxed at a rather lower rate, probably, than we would otherwise like. But I guess a bigger point might be that perhaps we should rethink whether it's really a liquidity crisis. We have a short-run liquidity crisis, possibly, but I think some of the policies that we went through just described about human capital, about training, about education, and a variety of other things along those, social insurance along the lines we mentioned, are kind of policies that are now more suited for coming out of this pandemic than excessive quantitative easing would be.
I guess one of the things I think we need to learn from the response to the financial crisis is that if you've got necessary monetary policy, which is driving in that direction, you probably want to use fiscal policy to offset that. For example, as Xiao was suggesting before, by changing the way in which you tax housing, and obviously would be to have a much more sensible council tax system, which was not regressive in the way that the current council tax system is, and fiscal redistribution, which offsets some of the impacts of monetary policy. All of that said, it is worth saying that there is at least a chance, I think, that this time round, depending on where we go, that we will see, we may see some reduction in wealth inequalities if, as seems likely, the stock market remains below where it was 3 or 4 months ago for a protracted period, and the housing market remains, house prices. I'm not making a projection here, but it doesn't seem implausible that house prices will fall, and possibly particularly in places like London, if it becomes less necessary or indeed less desirable to live in crowded cities with crowded public transport systems. So I think the direction in which that goes is pretty uncertain. We've got another very big question here, which is about the growing calls for some kind of basic income. For example, a universal basic income floor that acts as a floor under the rest of the social security system. And it's certainly true that it's not just, as Richard was talking about, calls for increased social insurance that we've heard, we have also heard these, it was happening to some extent before the crisis as well, calls for basic income, all of which is indicative of an atmosphere in which really quite radical change is at least being discussed and maybe more possible. Now, this is something we've thought about at the IFS for probably as long as the IFS has existed. But Xiaowei or Richard, do you want to have a first shot at our views on universal basic incomes?
I can sort of have a go, but so I'm not sure there's an IFS view on basic income. But I mean, personally, the trade-off is always, you can't raise enough taxes to make it high enough to actually give you an acceptable standard of living for everyone. And if it's any lower than that, then it's not going to be enough for lots of the population, right? So that's the sort of thinking behind a means tested system where, well, that's been eroded in recent years, but at least in the past, the idea was to make sure the support given to individual families were tailored to the needs of those families. And it's really unclear to me how you would be able to provide that with universal basic income. I think there are probably two reasons for the increased calls for UBI at the moment. I mean, I think one is just that means testing becomes increasingly inefficient when absolutely everyone needs income support. So assessing people's needs on an individual basis doesn't make so much sense. The second, I think, is that we've seen that the job protection schemes introduced by the government leave many people uncovered. So we know that the newly self-employed aren't covered by the self-employment scheme. Those who get just under half of their income from self-employment also aren't covered. Similarly with new employees who weren't on the PAYE system and before this all began, etc. So there's lots of groups that have been missed out in the current support, and I think that's also increasing calls for universal basic income. That might perhaps increase the need for UBI or the sort of rationale for UBI at the moment, but I'm unclear as to how that plays out in the future after this pandemic is over. And also, I think if the point is to fill in gaps in the current support schemes, and the easiest response is to improve those support schemes so that people are covered, rather than have this blanket support, which just isn't going to be enough for many families.
I'm going to stop Richard replying because we've suddenly got a whole host of questions come in just towards the end of this webinar. I mean, I think a short answer on universal basic income is exactly where Xiaowei started, which is you cannot provide one for everybody at anything like an adequate standard, or indeed at a standard which would mean that you didn't need other benefits on top as well, without taking taxes to wholly implausible levels. How much time have we got left? So we've got a few minutes left, and a lot of actually really interesting questions coming in. There's a couple here really about tax and should there be an extra tax when things are a bit better to pay down the COVID-19 debt, like the German reconstruction tax, and I think there's an interesting question here about whether we should be thinking about some of the support to businesses as being rather like income contingent loans. Should we be asking those that have been supported to pay back more if they happen to do well, rather like government taking an equity stake, or actually rather like the way that university fee system works at the moment? So that's one, and I'll ask the other. There's another question. I think we've got time for two, and I'll ask the two together and ask Richard and Xiaowei to try and answer either or both. And that's really, and I think that refers to some of the things that Xiaowei in particular was talking about with regard to the impact of the crisis on mental health. Does the panel see well-being measures being seriously considered post-COVID-19 as a more central part of how government policy works? So one about how we might raise tax, whether there is need for something to help pay down the debt, and one about the role of policies towards well-being. Richard, do you want to start, and then I'll give Jiawei the last word?
Yeah, they're both really tough questions, so I won't. There are 2 points here. I think one is in a kind of short-term sense, is there a role for an excess profits tax or something like that? And I think that kind of points to the view here that we're not particularly good at taxing incomes right at the top in perhaps a progressive or fair way. And I think that's, and one could, as we did in the Murley's review, think of ways of capturing more of excess profits when they occur. And that's something we might want to think about. And indeed, you could roll that out further on. But it is true that the point of capitalism and the point of capital is that capital and capitalists are supposed to, in some sense, provide the insurance against big events in return for high returns on capital. And one thinks of exactly you said, it may be that there's room to think about this more like a loan that's paid back. In other words, that really what the firm is doing is providing some insurance for society and for workers. And they take more of the hit than you would expect. That's the role of capital and capitalism, and we don't expect to have to bail out all the shocks that firms or capital gets. That's the whole, in some sense, the idea of venture capital and capital generally. So I think thinking it of along the lines you were saying, it sounds a very, very good idea. One little thought on the last point is that, as we mentioned, when we're thinking of health inequalities, it really is these pockets of deprivation and low well-being, whether it's mental health, economics, family back, local facilities, and so the coming together of all these things, which perhaps is very well measured in a well-being measure rather than specific, very narrow measures that we sometimes bring to bear. So I think that coming together now, that we're even more highlighting than we have even through the period of austerity, especially by geographic area, may well be a real push towards broader measures of well-being when we're thinking about policies.
I was hoping that I'd have time to think about these answers when Richard was speaking, but these are very big questions indeed. I think on tax,
We've only got 1 minute.
Yeah, exactly. I think one thing to think about in terms of the fairness of how this debt is repaid is to think about the intergenerational inequalities. So I think it's probably not that controversial to say that in many ways this pandemic and our response to it has just been a massive transfer from the young to the old. So it's the old who are disproportionately vulnerable to COVID-19. The young are not particularly medically vulnerable, and yet the economic effect of the lockdown has hit young people hardest. So I think in terms of thinking about how the money should be raised to pay down the deficit in the future, we need to make sure that it's not just young people who are paying higher taxes through taxes on their labour income, when again older people who are retired aren't bearing that burden. We need to think about wider taxes on capital, on housing, etc. On the wellbeing point, I think this pandemic has hopefully highlighted inequalities in well-being and the importance of mental health, and perhaps hopefully that will lead to more channeling of funds towards mental health, for example. And I do think using well-being measures as a way of capturing all these interlacing inequalities is a very good idea, as Richard said. I'd be cautious about moving away from more objective measures of inequality, for example, in income inequalities, partly because they are more objective, and partly because, as we know, well-being is very much related to these objective conditions. So there's a clear correlation, for example, between income and well-being.
Great. Well, thank you. That was a brilliant answer, if I might say. That is the end. We have come to the end of our time, though we certainly haven't come to the end of the questions. This is one step on the long path for the IFS towards the Deaton review of inequalities. We will be bringing out an awful lot more over the next weeks, months, and years. So do stay tuned to this. If you want to see more of our work on the impact of Covid-19, do go to the IFS website, ifs.org.uk, and there's a whole subset of that with a remarkable amount of analysis my colleagues have done over the last couple of months on Covid-19, including on mental health. We had I think a landmark publication yesterday looking at the impact of the current crisis on mental health, and it's not encouraging reading, as Xiaowei was saying. Historically big reductions in mental health over the last 2 or 3 months, particularly affecting young people, and particularly affecting women. We will be doing more. We've got more publications coming up over the next few weeks, including one I think coming out tomorrow, looking at the impact of the crisis on inflation. One coming out early next week, looking at the geographical impact and geographical inequalities. We've got our annual look at changes in income inequality coming up also in a couple of weeks. So do keep an eye on our publications, on our events, and on our new podcast series, which we're putting up every week. So thank you all for joining us. Thank you to Richard and Xiaowei for their presentations, and to their co-authors for the work that went into this. And thank you to the Nuffield Foundation for funding the Deaton review. Thank you all.
Thank you.
Thank you.